Chair. I have no conflict of interest. I always, as a urologist treating female with recurrent UTI, was asking the question, is complementary medicine better than antibiotic, or are there any difference in efficacy? However, I couldn't have the answer to that until my first co-author, Sami Salahia, who is a medical student from Ain Shams University, said, okay, if we can do a network meta-analysis, we can compare antibiotic to complementary, even though the study comparing the antibiotic to placebo or complementary to placebo. So recurrent UTI is a very common entity in female. We're talking about uncomplicated recurrent UTI in a female, straightforward. And the recommendation is to use prophylactic antibiotic. However, all of us who use that, we ask how long we need to use the antibiotic, what is the duration, what if we have resistance, etc. A lot of questions which we couldn't have the answer. Yesterday there was an interesting presentation from one of the professors from America about microbiome, and we're changing it with antibiotic. So the less we use antibiotic is the better. So the aim of the study to conduct a systematic review to assess the long-term efficacy of antibiotic and complementary medicine. We identified about 13 randomized controlled trial, 1,279 patients, and this is our study design. At 6 month review, we found that demon nose has the highest ranking drugs as prophylactic antibiotic, followed by nitrofurantoin, then trimethoprim and sulfamethoxazole. However, at 12 months, norfloxacin had the highest efficacy, followed by trimethoprim, followed by nitrofurantoin as efficacy for prophylactic antibiotics. As regarding to the adverse event, of course, you know that nitrofurantoin, I'm not surprised, was associated with highest risk of adverse event compared for other interventional, both at 6 months and at 1 year. However, our systematic review showed that if we use nitrofurantoin as an intermittent as opposed to continuous, that can decrease the side effect. Our conclusion, demon nose had better efficacy at 6 months, followed by nitrofurantoin, followed by combined trimethoprim and sulfamethoxazole. At 12 months, norfloxacin was the best efficacy at 12 months, followed by trimethoprim and nitrofurantoin. However, unfortunately, all the study which we found is up to 1 year. So we need a larger sample, prospective randomized trial with longer duration follow-up, then we can draw a better conclusion. Thank you very much.
Thank you. I'd like to make a comment from the UK perspective, because both norfloxacin, which is a fluoroquinolone, and nitrofurantoin have health warnings for long-term use, as I'm sure you're aware. So although they're very useful as short-term courses of antibiotics, we can't really give them for prophylaxis in the long term.
Hence the demon nose actually now a solution. And you mentioned of the heparin.
Yeah.
Exactly. So we're moving toward the complementary medicine more and more, unfortunately.
Lawrence?
Yeah, just gonna, I mean, it's interesting that D-Manage is so good at 6 months and disappears at 12 months. Is that because there's no studies without the 12 months?
Yes, yes.
Essentially.
And if you read the European Urology Guideline, because they didn't do the network indirect meta-analysis, they said in the conclusion, 2019, nitrofurantoin and demon nose, they have the same efficacy. However, when we conducted the indirect network meta-analysis, that showed at 6 months it's higher ranking in efficacy.
Can I just make one other comment? I think that the term complementary is always felt derogatory, and we need to move away from that term because these are obviously working.
Well, the European guideline use non-antibiotic. We
Yeah.
use complementary, so you call it whatever you call it.
No, but I think it's a group we need to think, because it is felt to be a derogatory term by many people.
I think it's the ICS terminology now need to identify that.
Yes, please.
Ashpat from Canada. Was there any assessment of quality of the trial?
What is that?
Was
Sorry?
there any assessment for quality of the trial?
Quality of life or
Quality of the trials, like the,
Well, of course, we actually excluded any non-prospective randomized trial, not well conducted studies, of course, yes.
but no validated tool for quality assessment?
I don't think so. Thank you.